Welcome to Sleepy Nursing, the podcast where we break down nursing school stress into something you can actually fall asleep to. I'm Nick, for some of you, Mr. Forney, and I teach nursing students how to think critically, survive the chaos, and still get some rest. If you're watching this while you're working through nursing school, I want you to know you can do it. You owe it to yourself to succeed, and you're doing a great job. Tonight, we're going to talk about the heart. This is going to be a two-part video podcast. Tonight, we're going to do sort of an overview covering some anatomy and some of the base dysfunctions. And on the next video, we'll go a little deeper. Now, the heart. The heart is central to all of your body systems. Every single cell in your body needs a supply of blood and nutrients. The heart is the thing that pushes it out there. So when it's working right, we don't even really think about it. Sometimes if you're laying really still, you can feel your heart beating, or if you can feel your pulse, but you don't spend a lot of time thinking about your heart necessarily unless you have a problem with it. As it starts to not function right, fail, or any of the things it may do, we see issues in the heart, but we also typically see issues through other systems of the body as well. Now, I want to start with a discussion of the anatomy of the heart. I think this is essential to be able to understand the rest of it. So make sure you spend some time, look at some pictures of the heart anatomy, and be familiar with how it works. First of all, the layers of the heart. There is epicardium, myocardium, and endocardium. If you break those down, epicardium goes around the outside of the heart. This is similar to other medical words we've used. The myocardium, where have you heard myo before? Myo is talking about the muscle layer of the heart. And then endocardium, what do we think endo means? Endo is referring to be the inside part of the heart. Think of endothelial tissue inside of vessels and things. Endocardium is just the inner lining of the heart. Now, surrounding the heart is a sac that it lives in. We call the pericardium, and there's a pericardial space. So peri going around, think like a perimeter. The pericardial space has about 30 to 50 mLs of fluid. So if you think about one of those little 10 cc flushes, about 3 to 5 of those. That's important because the heart is always beating and always moving, and it needs to have adequate lubrication to keep doing that. Otherwise, it would rub a hole in the pericardium. Now, within the heart itself, there are 4 chambers and major valves. When blood comes in from the systemic circulation, the last stop before it goes into the heart is the vena cava. From the vena cava, the superior vena cava, that's the top of it, it goes into the right atrium. From the right atrium, it passes through the tricuspid valve to the right ventricle. From the right ventricle, it's pushed into the pulmonary circulation. This is the only time you'll have an artery that is pushing non-oxygenated blood, which an artery is pushing blood away from the heart. And in this case, it's pushing it into the lungs to become oxygenated. So this is a good sort of trick question you might see on a test. Which artery is the only vessel that pushes non-oxygenated blood? And it's the pulmonary artery. From there, it goes out into the lungs and undergoes the oxygen exchange, and it comes back through the pulmonary vein, which is the only vein carrying oxygenated blood, back into the heart. From the pulmonary circulation, it goes into the left atrium, and it passes through the mitral valve down into the left ventricle. Now, the left ventricle is the big, meaty part that helps push blood out to your whole body. So think of that as the very strongest part of your heart. There is an aortic valve between the left ventricle and the aorta. And backing up a few steps, there's a pulmonary valve between the right ventricle and the pulmonary vasculature as well. Now, from there, it goes out into systemic circulation, your blood does. It goes out from the aorta down through all the other arteries and the arterioles out to the capillaries where the actual exchanges happen. And from the capillaries, it comes back through the venules and into the veins and into the superior vena cava, or the whole vena cava, and back into the heart again. Through all of this, I do want to highlight the heart valve function. You have likely heard of some valvular dysfunction. You may have even heard of some people having valve replacements, which can be very interesting. Those are some, especially the mechanical valves. You can sometimes hear them ticking from the door of the room. But those valves have to work to keep that blood from going backwards. So when the pump squeezes, it needs to push the blood forward so it can move on through the rest of the blood system, the circulatory system. When those valves fail, it'll back up and not get pumped like it's supposed to. We call that regurgitation. So when you think about heart valves, I want you to think about them working like doors inside of the heart. They keep opening and closing to keep blood moving in the right direction as it flows through the heart. And they make sure the blood doesn't go backwards. So if you think of them like doors in a hallway, if the door opens the right way, people, in this case blood, moves smoothly from room to room. If they're stuck or swinging in the wrong way, people may get backed up or lost, and the hallway doesn't work right. Now, there is more to the heart as well than just blood pumping through it. The heart also has an electrical conduction system. These are the nerves and fibers that send the signals to tell the heart to contract exactly the way it's supposed to. This starts with the SA node, that's sinoatrial node. We call that the pacemaker of the heart. That's beating like a metronome, tick, 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 however fast your body's supposed to be beating its heart. Obviously that can go up if we're exercising, it can go down if we're resting, but a normal heartbeat is started by the SA node sending out an electrical signal. The SA node lives in sort of the superior part of the right atrium, and from the SA node, it sends its electrical signal that goes down through the atria, triggering that atrial kick that's a little squeeze. From the atria, it goes to the AV node, that's atrial ventricular node. Now, if you look at the waveforms of an EKG, which we'll be going over in the next video, you can tell there's a little pause between that atrial kick and the ventricular contraction. Think about it, the blood. If I had a cup of water that I was trying to move somewhere, if I let it go from my hand, it's not going to immediately hit the floor. It takes a moment for it to pass through via gravity down to the floor. So the blood has to transit from the atria down to the ventricles too, and the heart knows that. So it gives it a little pause there at the AV node where it holds that beat back, just a tick. That allows the atrial kick to do the squeeze and gravity to help too and push that blood down into the ventricles. Now from the AV node, the signal goes through the bundle of His and out into the Purkinje fibers, which go and innervate that whole ventricular section, so the right and left ventricles, so they can squeeze together and push the blood into the next spot where it's supposed to go. So when that works right, we don't even notice it, and our blood just keeps pumping on along. When it doesn't work right, we can have a number of different dysfunctions. We could have missed beats. We could have the heart running too fast where it can't effectively move blood from one chamber to the next. We could have it kind of all over the place. There are a number of different dysrhythmias or arrhythmias, which we'll talk about in the next video. So now that we've talked about some of the basic anatomy of the heart, I want to talk about the cardiac cycle: systole, diastole, and output. Some of these terms might be familiar to you all. As you've learned about blood pressure, we have systolic pressure and diastolic pressure, and these go right back to the heart and how the heart is functioning. So about every minute, the heart pumps 5 liters of blood through. So think about those 2-liter big bottles of soda, 2.5 of those being pumped through the heart every minute, basically forever. When we think about cardiac output, we're thinking about how much blood that heart actually puts out. We can determine this by multiplying the heart rate by the stroke volume. And the important thing to think about this is that both speed of pumping and the amount of blood that's pumped, the stroke volume represents how much blood is squeezed out of the heart each beat. They're both important. That's why when we exercise, our heart rate will go up. And when our bodies are compensating for something like hypovolemia, even though we'll see the blood pressure go down because we have insufficient volume, we'll see the heart rate go up to try and compensate for that. There are some concepts associated with this. Preload is the pressure from the systemic circulation that is pushing against the heart before it beats. Afterload is what's afterwards. Contractility, how much it wants to squeeze. And one of the ways we measure this is with ejection fraction. Ejection fraction is a way to measure how well the heart is pumping blood. It tells us what percent of blood the left ventricle, which is the heart's main pumping chamber, like we talked about, pushes out with each heartbeat. A normal ejection fraction is usually 55 to 70%. So yours and mine sitting here, if we don't have cardiac issues, it's probably in that 55 to 70% range. That means more than half of the blood in the left ventricle is squeezed out to the rest of the body with each beat. If the ejection fraction is low, it means the heart isn't pumping well. This can happen with heart failure or other problems. You can think of it like squeezing a sponge. If you don't squeeze very hard, less water comes out. Just like a weak heart doesn't pump out much blood. Now down into blood vessels and circulation. So arteries are our big oxygenated blood vessels, and veins are our biggest deoxygenated returning to the heart vessels. And then at the end of all the arteries and veins are these little capillaries where the gas exchange happens. When the blood flows out to all of our cells, we call that perfusion. And perfusion tells us about how well the blood is flowing through the body to bring oxygen and nutrients to the tissues and organs. When perfusion is good, the body's cells get what they need to stay healthy and work properly. When perfusion is poor, parts of the body might not get enough oxygen, and that can cause problems like cold hands, cold feet, confusion, and even organ damage. Some of the organs that are most susceptible to poor output are your kidneys are very susceptible, your brain, and your lungs all need a lot of blood flow. So you can think of it a little bit like watering a garden. If the water, in this case blood, flows well through the hose, which is the blood vessels, the plants, in this case body tissues, stay healthy. If the hose is blocked or the pressure is low, the plants don't get what they need and they'll start to wilt. CHF, congestive heart failure. This is when we're turning into actual failure and we get into a little bit of pathology here. There are two major types of congestive heart failure, left-sided and right-sided. And think about that as we get further into it. The left side of the heart pumps blood out to the whole body, and if it doesn't pump as well, it'll back up into the lungs. Whereas the right side of the heart pumps blood into the respiratory system, and if it doesn't work so well, it's going to back up into the systemic vasculature. Heart failure means the heart isn't pumping as well as it should. It doesn't mean the heart is stopped. It just can't keep up with the body's needs. If the heart is weak or stiff, it can't push out enough blood. This can cause problems like tiredness because the muscles aren't getting enough oxygen, shortness of breath because fluid builds up in the lungs, swelling in the legs, ankles, and belly because fluid backs up. Now, left-sided versus right-sided heart failure. As we teased about before, the left side of the heart pumps blood out to the whole body. Now, if it doesn't work as well and blood gets caught there, it's not getting pushed out as well as it should, that blood is going to back up the next step back in line. So from the left ventricle, left atrium to the pulmonary circulation. So if it's not pulling blood out, the right heart side of the heart may still be pushing for a while. These are very interconnected. So if one fails, you'll likely see failure on the other side sooner than later. But if the left side is primarily failed, we'll see mainly pulmonary systems. These patients will have crackles when you listen to their lungs, auscultate their lungs. They'll have shortness of breath, fatigue, orthopnea. What's orthopnea? Do you remember? That means that their breathing may be worse depending on how they're situated. If they're laying flat on their back, their breathing's not going to be as effective as if they're sitting upright, where our lungs really want to open up and expand, and they can do that when we're upright. Now they're kind of filling up with fluid and not working as well anyways. that moves us over to right-sided heart failure, where you're more likely to see systemic symptoms. This is going to be swelling and fluid throughout the body. If the right side of the heart has failed and it's not pumping like it's supposed to, that blood's going to back up. Some of the places we can see that, if y'all remember from your physical assessment, jugular vein distension, JVD. And this is one of the visible places you can see those veins backing up and congesting. And you can actually see it so clearly that you'll see the heart beating through there sometimes. It'll be sort of pulsing or throbbing there through their throat. Think a normal person, you can't see these veins in their neck at all. But in a patient with JVD from congestive heart failure, you will see them pretty prominently. You can also see edema and ascites, so buildup of fluid in different places. Very common, this will be dependent. That means lower. So gravity works on the fluid in our bodies just like it works on everything else, and it'll pull that extra fluid down to our feet and ankles and legs particularly. So you're more likely to see swelling down there than anywhere else, though you can see some periorbital edema as well. And I want to remind you all, if you see one side of the heart failing, you can often see failure leading to the other side. Now,